Hello, and this video is just to demonstrate what equipment midwives would bring to you if you were planning or choosing to have a home birth. And it's just to make you aware that whether you are choosing to have a baby at home or in one of our birth centres in Powys, essentially the equipment that we carry is exactly the same. So if you are thinking that you want to have your baby in a birth centre, please don't rule out home birth as well, because what we have in a birth centre, as I say, is what we would bring to the home. The only difference between the two settings is that there is a fixed in birthing pool in one of the birth centres. Otherwise, everything else is exactly the same. And if you were thinking that you wanted to have a home birth with a pool, you can hire blow-up birthing pools from private companies online. They're not too expensive and they do fill the job quite nicely, so you can still have a water birth at home if that's something you were thinking you wanted to do. And as I said in the last video, if you are experiencing a pregnancy which is low risk without complications, the recommendation is that you birth in a midwifery-led setting, and that does include home births as well. So just to show you what midwives would bring out to your home birth situation, you're all probably very familiar with our main kit bags that we carry, and within the kit bag we've got different segments which would cater for different situations. So our blue kit bag here is basically got all of our general equipment in to be able to provide you with a full antenatal or postnatal check. The red bag here has got everything in we need for taking bloods, or if we needed to pop a little cannula in your hand, we've got some equipment for that as well. In the green pouch here, this is what we would use when you were having your baby. Essentially, we've got in here all of the drugs that we might need should there become a problem after the baby's born with slowing down blood loss and things like that. Or if you were choosing to have your placenta born medically, we've got the medication in here that we would use to give you to help the placenta be born in that scenario as well. And then if we were to need to give you any fluids for any reason, so if you were losing a little bit too much blood, or maybe your blood pressure dropped a bit too low, we have got the equipment in the black pouch here to be able to pop up fluids for you, and we've got extra fluids in there should we need to add medication to them to try and again slow down any bleeding if we were concerned about that after the baby was born. If you were phoning us to tell us that you thought your waters might have broken before your labour started, we have got equipment where we could come out and see you at home, or you could come to the birth centre without having to go to a bigger hospital, where we could check to see whether it definitely was your waters that have broken. And we've, as I say, we've got equipment and testing strips to do that test locally, so you don't have to go anywhere for that. And then if after you've had your baby either at home or in the birth centre, we are all trained to be able to suture, so that stitch up any tears that you might have down below, and we carry all of that equipment in our yellow pouch there to be able to put stitches in if we need to. And of course we have local anaesthetic which we would give to numb everything up so that you wouldn't feel that happening. As when we think the baby is about to be born, we have a birthing pack here which we will open up, and that just carries some essential equipment. Again, should we need anything as the baby's being born, much of it we don't use, it just gets discarded, but we have got it just in case we need it. And as far as equipment is concerned for kind of babies after they're born, we carry a full set of neonatal and adult resuscitation equipment should we need to do that. And that also includes some oxygen if we needed to give babies oxygen, a warming pad in case we had a baby that got too cold and we needed to warm them up quickly, suction equipment, airways if we needed to pop an airway in the baby's mouth to help with their breathing after they're born. We've got all of that initial equipment if we need to. What we tend to do in a home birth situation is ask when we arrive if we can set up a corner of the room somewhere quiet where we can have all this equipment out ready, and it's there for us if we need it in that situation. But most of the time we don't need to use anything. And as far as pain relief is concerned in home birth situations, we carry gas and air which we can bring out to you, and we carry ample amounts of it. So if you were using a lot of it in labour, or you were having a longer than average labour, then we have got enough supplies to be able to get you through that labour until the baby's born.